Good morning, everybody. And before I start and get into the whole program, I do want to tell everyone we have to remember the 385 people that passed away. It's been a long 15 months. It's been a long 461 days and 66 weeks. But I think of the 385. And not just the 385, the people that died of loneliness, the people that just passed away from natural causes of life and had no one around them, and I think of the overdoses and the drugs and the relapse people had because of what we went through and the world we were dealing with and the children that went through mental health issues. So please, as we're out of this and we continue to go in the right direction, just take a moment of time and just take a step back and be happy and blessed with your situation, and think of people that really had it so tough for these 15 months, especially the people that lost loved ones. But it's hard to believe it's been since March 12, 2020. Dr. Will and I have guessed time and time again we'd be done by December of last year, and who knew we'd be here 15 months later. So it has been a difficult time. It's been a challenging time for not just me, for our department heads, for the way we delivered services, and the way we got shots out, the way we handled different things, and how to reinvent or reimagine the workforce. Kind of did like when there was limited people in the building. It was nice when we were shut. Not that we were shut down, so please don't take that wrong. But when we were, when there was less people in the building and you could move around quicker and get downtown Albany within 5 minutes versus 20 minutes now. But again, it was a lot of trials and tribulations for business owners, for the workforce to overcome, and the businesses that shut down, from gyms and everything else. So it's been tough, but I am proud to sit here with my partners, because I use that word partnership and I get criticized a lot, because it takes partners to come together and to leave the egos out the door. And trust me, in politics, as a politician, that's the hardest thing to do sometimes, is to not be the biggest head in the room. Is to roll up your sleeves and do it for the right of the people. But to be at 74.4% of 18 and older is an achievement, not just our Department of Health, all of our partnerships. We're 74.4% for the first dose, and we're the first in the region, the state, that hit the 50% marker, which, it's nice. It's not a competition, but it's nice when you're out on top and you're doing your job and we're trying different things to get things done. And it couldn't be achieved, first and foremost, by the people that rolled up their sleeves, that took the vaccine, the people that wanted the vaccine, the people that educated other people to get the vaccine. And it can't be done without our counterparts throughout the capital region that I worked with in the 7-county capital district. And some of the things people will never know is the things that we went through trying to help each other out, from PPE, testing kits, vaccines, whatever we need to help each other, working together. And I can't be prouder, to work hand in hand with the governor in the governor's office, Steve Bolger up in Saratoga, Sam Hall in Washington County, he's a colonel, retired from the New York Army National Guard, which I worked for. He was my boss, so it was ironic to run into again, never knew where he went in life. Major General Murphy, doing the control rooms. Not that we always agreed. We agreed to disagree a lot on these control rooms, but they're productive, and he held us to a task. To Steve Aquario from NISAC, who I can't thank enough for this partnership as we move forward and did things. And, it was tough, and we had to reinvent the role. I was president of NISAC at the time, and we had to bring everyone together, and not just county executives. There's more county managers upstate New York than there's county managers, and working together as a team. And to Mayor de Blasio, who I was talking to 3 times a week, who became a good friend. We've hit it off, and just working back and forth to have that connection with the mayor of New York City, to talk on the phone and talk about different issues, and the county executives I talk to every night. It was all of us working together to get through this. Our Medical Reserve Corps, can't thank them enough. The men and women that volunteer for that, not just for this case, that are there every year when nothing's going on to practice for this situation, to all the volunteers that volunteered, thank you so much from the bottom of my heart, because it couldn't have happened without the volunteers and without people giving up their time and being not selfish with their time, but helping out. And thank you, thank you, thank you. We couldn't have done it without our partners every step along the way, from securing PPE to helping business secure grants and loans to showing our community coming together to help feed those who needed it. So I do want to thank Major General Shields from the New York Army National Guard for letting us use the National Guard troops to help feed people that were in a quarantine that couldn't get out. I do like Ray Shields better than Murphy because I do currently still work for him, so I got to be nice. I got to be a little biased on that one. But again, thank you to the men and women in the New York Army National Guard that were on the front line more now than ever before. And people tend to forget we've been at war for 20 years. So the strain of the New York, the National Guard and reserves and all of our units have already been deployed to the borders around the world, and now here on the front lines at home helping the men and women in the state of New York is probably the best mission that they've ever had to give back to their communities. Working with the Muslim community, coming forward to help us raise money to get money out to United Way and other areas. I don't want to forget anyone, but United Way, Pete Gannon, Pete, thank you for everything. And I've always argued with him privately. We've argued time and time again, and it's brought us together, because all that stuff has to go to a side. It's not about you. It's not about the individual. It's about getting the job done. And I always said that to everyone. It's, you can't take it personal. You just got to move forward. And like as the EOs came out and it felt like hurdle after hurdle was being thrown at us, it was one of the things that I said, look, hurdles in life are meant to get over, and we need just not to cry about it. It's their football field. They make the rules. We got to live on it, and we got to get through it because we need leadership. You need a constant message, and we need to do extraordinary things for the people that we're in charge of. To Dave Shippey, from Whitney Young, thank you. To Whitney Young's partnership. To Mohawk Ambulance, to the various EMS services, Colony, Gildan, Queens, Ravina, thank you for partnering with us. Sheriff Apple's department, thank you for what you do with your EMS department. To the temples and to the mosque and to the churches, thank you for holding vaccine clinics there so we could get your people on board and they believed in it because you talked to them. To the school superintendents, to the Capital District Latinos, to letting us have pods there, to school superintendents and principals. I feel like I was back in school. I got to know the superintendents this time versus the principals, but spent a lot of times with the principals for the wrong reason. But it was nice to work with them and the challenges they had to go through, changing the rules, mask, no mask, social distancing, remote learning. It was a challenging year for superintendents, principals, administrators, the workers in the school system to educate our children to go forward. And let me assure you, my hat's off to them because they had a difficult time dealing with parents that, again, like I said, mental health was a big concern for a lot of people. And what's the first thing you do when your kid starts getting in, something's going wrong? You're yelling at the teachers. You're yelling at the people trying to help them. So I say this to the teachers and to the administrators. Thank you. Thank you for keeping your cool. Thank you for doing your job. And we learned how to remote learn. So I don't think we need snow days anymore, though some of the teachers that are family members of mine were a little pissed. They don't want to hear that. They want to get their free day off. But we can remote learn now. So if there's a problem, we can do it. If there's a problem in the county going forward, hate to say this to the county workforce, when there's a snow day and I got to close the building, we can work remote now. We don't have to shut down. We've learned so much. There are IT departments doing things differently. It's been challenging, but guess what? It's been rewarding too, that we can deliver our quality services that people expect and should expect and deliver them better and smarter and quicker. And that's what we've learned these last 15 months. Introducing technology, I feel like we went 10 years finally in the future, whether where we're at. It's hard to change things, but again, thank you to the partnerships from Stewart Shops, Duncan, Albany Firewolves. Can't thank you enough. But unfortunately, we're not done. To get today, we've lived through a lot. We had businesses shut down. We had the progress of reopening. The Camoin study we did, the money we spent to get businesses reopened, come up with that plan. We were sitting back trying to think about how much we just did in a week versus the 66 weeks. How many things have changed? How many times we made a decision and an hour later that decision was overturned or changed, or the guidance never came. It's tough. I brought it up 2 days ago about the guidance. I had the military over the weekend. They still haven't had guidance from the state health department on whether or not they can wear masks. Well, they're probably all happy now as of today because you don't need to. But our local gyms, our restaurants that struggled, our salons, learning about 15 or air filters, our Merck 15s and 13s. I'm like, what the heck? But really looking at how our air handling systems were in buildings, it was challenging, but we got through it. And we got through it by leaning on each other and reminding people it was a marathon, not a sprint, because you're never going to accuse me of physically running, other than for office. But, it's one of the things that you look at as you go forward, that it was a long-term haul. And one of the things I take pride in is setting up the mental health hotline the next day, knowing that we needed it. And I learned that from my military experience. It wasn't just, the world was changing in front of us. The world was going in a different direction, and people needed to have that lifeline to talk to. And that's why I said, I don't care if what bothers you may not bother me. We got different threshold of pain. And, but not everyone has that. Not everyone can deal with things around them, and they fall apart. And that's why we had the mental health hotline, sexual assault hotline, to call, to get help, to, drug addiction. We were trying everything we could. And I do want to say to Dr. G and his team, thank you so much. So as we proceeded to reopen and move forward, that was a year ago in May. As we started to reopen, everything we have done since then brought us here to today, working together. We can go into restaurants and malls now, so we can go to the movies, we can go to arcades, local shops, gyms, salons, everything else. And the special cleaning procedures, which I do have a little bit of OC no one knows about, so I don't mind the extra cleaning and everything like that going on, and it's nice sitting on or standing on the elevator with just 4 people and not being crowded in. But but these are good things. We're getting back. So many things have been done virtually, including how our kids have gone to school, why the state has lifted its regulations. There's still, and I want the parents to pay attention, there's still the CDC guidelines, which governs what happens in schools, and schools themselves can require masks. So it is the last. No, wait. Next week's the last week of school, right? I think.
Yes.
Yeah. Right. Oh, you would know. You got 2 little ones. Next week.
Next week.
Good for you. Yeah. So next week's the last. I'll be thinking of you. Next week's the last week of school, and I talked to some parents over the weekend. I know they don't like their kids wearing masks, but let's just get through it. Whatever the school district decides, and hopefully summer school. And the fall it's going to be normal as long as we don't go in the wrong direction. So please, we need to continue to do that. For our nursing home, one of the good things is if our workers, or if they're vaccinated, they don't have to get tested. But the workers that choose not to, and some of the workers that choose not to get vaccinated, still have to get tested twice a week under the guidance, and still wearing masks in nursing homes and federal property, stuff like that. So public transportation. So I think it's important, and I thank the media. It's important to get the message out there to everyone that you still are going to be required to wear a mask in certain times, and in your comfort zone. If you're comfortable wearing it, I think Dr. Oil and I were joking around about, I remember before COVID-19, and you go through an airport and see people with a mask, you kind of chuckle saying, look, I'm wearing a mask. I'll probably be that person from now on when I go travel, just because of the germs and everything else you pick up. So again, just be tolerant of other people. Now you don't have to. If you haven't got the vaccine, please stay 6 feet apart. Please continue to wear a mask and cough into your arm, clean your hands, and do the right thing. And to the people that say something, I've seen people now challenging people with masks. What do you got the mask on? Take it off. Respect them. Let them, if that's what they want to do, respect them. Take a step back and just be happy you don't have to wear that mask anymore and move on. So. We have to be partners. Before I go on thanking the rest of my team, I do want to say something that people don't see. And what goes on when you do these daily briefings, it's the people behind the scenes like Mary and Mike and Andrew and Cam and Toma and everyone like that. But most importantly is that I think one of the things the media has left off, and my writer over here from the Altamont Enterprise to my right, and is the fact that you're here every day. The fact that you are out getting the story, even you back there, I have to say this, not that I want to, but even you back there, you were here every day reporting what was going on. So people who stayed home doing the right thing got themselves educated, whether they agreed to what I was saying or disagree with what we were saying or Dr. Whalen was saying or whoever we had up here was saying. You were reporting the news and you were bringing back questions from people that had concerns about certain things. And I do want to thank you, because it does take the media and it does take the radio to certain radio stations. It does take the radio to really get that message out there so people stay calm and they could be informed and they can get the information they wanted. So there's a big applause to you, because you had to learn how to do your jobs differently. You had to do things differently, and you still had to show up every day. So I want to say from the bottom of my heart, thank you for what you're doing. Not that I agree with every story and paper article, but it's the fact of life and I have to live with it, right? But thank you for what you do. But I do want to say thank you to my staff, to Jenna, Sandy, Amanda, our 3 secretaries, and to Dan Lynch, my deputy, Jeff Jameson, George Penn, Mike McLaughlin, Sean Thalen, Dave Riley, Sandra Williams, Pat Alderson, where is Pat? Is he here? To Luke, I already said Mary and Cam, Amna, Joe Bonrigo, Toma, thank you. My whole budget team, thank you. Sarah, I have driven them crazy for the last 15 months, 7 days a week. They're like, please go home, take time off, get out of my office. Dr. Whalen, we drove each other crazy, trying to figure out things and going forward. But you're only successful with the people around you. And, I want to say thank you for helping put these briefings together, the information, arguments, and everything else that we've gone through, but the great initiatives that we did, and I couldn't have done it without my staff. And I can't thank this team enough. It's the best team I've ever worked with these last 15 months. Dan Lynch took over as my deputy. Before this happened, literally 2 months before we hit COVID-19. His first day in the office was a snowstorm, like Phil's first day was. Phil leaves, and then we hit the COVID world. We had Chris Quinn before she left through May, and then Jeff Jameson took over. So it was tough. It was tough on my staff. It's been a learning, but we've learned so much, and we need to take what we learned to apply it to future issues of emergencies like this, but most importantly, how we can operate going forward. So again, to all the incredible department heads in Albany County, thank you so much. I can't list every one of you, but you all had a hard time, and everyone had to work together. And thank you for the way you move your department, and we got through this. The bottom line is we don't want to even go back to January 1 of this year, when we had the largest single day of new positive cases, which was 346, because we know how deadly COVID-19 can be. Masks still need to be worn, like I said, in nursing homes, healthcare, and like I said earlier in the beginning of this, please just think of the 385 people that passed away from this, and whatever your thoughts are. And I sincerely mean this. I try to, when people send me messaging, to answer them. The one person knows I answered them at 2 o'clock in the morning. I thought about what I was going to say before I responded. But we can agree to disagree. But the reality is this, I'm not here to scare you. We weren't here to scare you. We're here just to give a simple message and keep calm and get through this health crisis. I know not everyone's going to agree with our messaging. Not everyone agrees with the vaccine. Not everyone agrees with masks. That's what's great about this country. That's what the foundation of this country is built on, to believe in whatever God you want to believe in, and to live your life to whatever way you want to live it, in peace. So just remember, step back, deep breath. We're there, people. We are there. And we're there because of everyone that rolled up their sleeves and did the right thing by staying home. But I do want to say to the Shaker Place staff, I can never thank the workers up there enough. To every nursing home across the state of New York, what they went through. To Larry Slacky and his whole team, and I wish I could mention every worker up there, what you did day in and day out, and you became their family. They're our residents. They're not our patients. They're our residents. It's their home. We built a beautiful facility. I can't wait to have the media take a tour of the money that we spent up there and how beautiful it is to have that end of care that you're going to get. But the men and women that showed up every day, and let me trust me when I say this, getting tested twice a week, getting that swab down here. We had workers complaining they were starting to get nosebleeds every week because the swab going down them twice a week. It's not an easy thing to go through. And then it's not an easy thing to know that the person you've been taking care of for a year hasn't seen their loved one. Only, and they would call the families, they would FaceTime the families. I could never pay you enough money or gratitude to say thank you. But to the workers that got us through this out there, thank you so much. You're all heroes to me. Everyone's a hero, from 911 to everyone else. But to have to do that and be with that person, unfortunately, if they passed away in the nursing home from whenever it was COVID-19 or whatever they were dealing with, it's hard because you were there at the end of their life. And I know the families appreciate it, and I've heard nothing but great reports back from the family, how great every worker out there was. So thank you for your dedication, not just to the patients or the residents, but also to the people of Albany County. So to our nursing home, thank you. And our nursing home, our hospitals across the state, thank you so much. Like I said, we've learned so much over these last 15 months. And I could go on and on and on. And I don't want to. But I think it's important that we continue to tell people, do the right thing. And I take pride that we put out 69,990 first and second doses of the vaccine with partnerships. If we didn't do it physically, we're just one shot away from the 70,000 marker. So if there's anyone here that wants it, you can be number 70,000 for us and our anyone. Everyone got it? All right. Could have found somebody, Mary. The governor's people would have found somebody. But But again, it can't be done without a partnership. And to Dr. Whalen and her team, I sincerely mean it. I know it's been tough. It's been a tough 15 months, and it's nice to be at the end. I do want to say, before I let Dr. Whalen say a few things, that we do have the upcoming pods. We're still doing pods. We're doing it differently. Queeman's Landing Park from 4 to 7, which is today. We're hosting a vaccine clinic on Friday on Juneteenth, block party in Albany at the corner of Broad Street and Alexandra, which I said before, 12:30 to 3:30. And we're having a clinic at West Hill Refugee Welcome Center in Albany on June 22nd, 4 to 6. Daryl, that's my birthday. If you want to send me a card, June 22nd, just say. Okay. So we're hosting that, and you can get the Pfizer and the J&J vaccines available also. And please, you can come down to our Department of Health anytime, Monday through Friday. No appointment necessary. Talk to a great nurse, talk to somebody, and talk about why you should get the vaccine. If you haven't, anyone over the age of 60, again, we say this, we need transportation, 518-447-7198. And the same thing, if you're homebound, please call the same number. We are out of this. But the reality is this: we're still going to be going forward with the vaccines. It's going to change. One of the things we keep lobbying with the governor's office is to change it so doctors, physicians can do it, pediatricians, and getting kids under 12 vaccinated, which I think is so important. But I think that should really be done by the kids' pediatrician, not just at a pod, so the parents can talk to them and talk about everything that they need to know. So hopefully that gets done that way in the future going forward. But as always, our website, go to our website, albanycounty.com, and you can get all the information you need. So as of yesterday, 63.8% of Albany County's population received the first dose, and that's from 18 and above. So I just want to remind people that. I know people were getting caught on that number because we do report two numbers, and it is kind of confusing. Over 18 years of age and older, it's 74.5%. So the 12 to 18 with the rest of the population in Albany County is 63.8%. So just keep that in mind. And it's nice to report 2 positive cases since yesterday. On April 6th, after I used this briefing to advocate for it, the governor opened vaccine eligibility to everyone under 16 years of age, which was good. So, hopefully we get that. The CDC comes out with the guidance for under 12. It's over the last 5 days, we had an average of 2.8 new positive cases and 3.2. So it just shows you we're there. I do, again, want to thank everyone, but I do want to say to Dr. Whalen, if you'd like to say a few words.
Sure. Well, I think today is a really important milestone. I think that getting to the level of vaccinating 70% of the adult population over 18 is something that we have worked for since we started planning efforts. And to get here has been a Herculean task, which many people have contributed to. I agree that there has been so much work done by so many different county staff, by health department staff, by the staff of the hospitals, first responders. It has taken a community level response, the likes of which we have never seen. And I am personally incredibly proud of the work that Albany County Department of Health has done. I think county health departments have long been under-recognized for the work that we do. And we have been planning for pandemic scenarios for many years, working with drills for these scenarios, for mass vaccination drills, and the work that our Medical Reserve Corps has done to prepare for that, laid the foundation for the response that we have been able to effectuate during this time. It has been a tremendous amount of work. In particular, I would like to thank my staff because we have worked 24/7. And I will say that, the staff that I have, I knew before this occurred they were tremendously dedicated and hardworking and incredibly knowledgeable and professional staff. But through this, I have just grown in my esteem for each and every one of them. We started with calls on COVID back in January of 2020 that alerted us that this may be something that we would be facing. And as we saw our first case in March, we swung into place with our contact tracing and case investigation, and worked with our state and federal partners to ensure that we were able to do testing, which of course was the cornerstone of control. And I believe, there were delays on that from a federal perspective, and I think that, we will have lessons learned going forward on how we can prepare for this in future iterations, hopefully not anytime soon. But being able to do this testing, being able to contact trace and control the spread, and as well as utilizing this platform and all of the assistance of those that are here in the media to be able to message clear, consistent messages to the public has been a tremendous response. Every one of you that are watching this, every one of you that stayed home, played a huge role in controlling COVID-19. We have seen the horrible effects that this has wrought in other parts of the world and in other parts of the country. And what we as county really worked for is to prevent hospital surge capacity, and we were successful in that. We did not see in Albany County what we saw in other parts of the country and other parts of the world, hospital emergency rooms overflowing, although we were prepared for that. And that is largely due to the planning and communication and work that we have done on a daily basis. I'd like to take just a moment to thank my staff in particular. Again, Mary Beth Miller is the Deputy Commissioner of Health. She has worked at the Health Department for 33 years, formerly as Nursing Director, and has just worked tirelessly to ensure that we had systems in place and to be able to go forward with our response, and continues to do this work. Shanna Witherspoon, Assistant Commissioner for Finance, has also been instrumental in planning and deployment of resources, as is Kathy DeThomasis, our Nursing Director, who has been with us for many, many years as well. She and her team, including our epidemiologist Liz Lewis, was in charge of doing case investigations and contact tracing. Tricia Bulato is head of our Division of Preparedness, and she has been instrumental in all the pod planning, and this is work that we continue to do on a daily basis, coordinating our large Medical Reserve Corps, and we have over 400 volunteers, without which this response would not have been possible. Again, these are people that are healthcare workers, health professionals that have volunteered their time to come in and work with us to ensure safe vaccination of the population of Albany County and those across the state as well. Charles Welge, who is our Director of Public Health Education, has worked as well with messaging and making sure that there are community health workers out addressing concerns of all the populations that we are trying to vaccinate. We have community health workers that are still out in the field on a daily basis, talking to members of the community and ensuring that they have the knowledge that they need to make the decisions that they have. And Eileen Franco also has joined us as a interim division of environmental services. She has also led many of the pods operationally and has done a phenomenal job. I would like to be able to mention all the staff, but there is not time. But I just want to say that the work of local health departments is essential. And going forward, I really hope that across the state this is recognized, and we can continue to serve the public in this essential way. Finally, I'd like to say that while this is an incredibly important moment to look at the achievement that we have had so far, I don't think we've crossed the finish line yet, and we are still working very closely to ensure that we continue our educational and vaccine efforts. We still have walk-ins on a daily basis, and I wouldn't be surprised if, as we are sitting here, we have crossed that 70,000 mark, because we have people walking into the department every single day. And we will continue to do this and work with community partners to get out to communities. We have found a strategy throughout the pandemic is to be able to interact with people where they live, work, and pray. And this is something that we do in all our programs and services and have for many years. So continuing to do this work around vaccination, around education, will be at the forefront of our efforts. I do not believe at this point herd immunity has been achieved, and I think that this is something that we can continue to work towards. If you have not yet received a COVID vaccine, you can still contribute to this effort by being vaccinated. The vaccines are safe and effective. We know we still have a large percentage of those under 16 to be vaccinated, and those under 12 have not yet received authorization for vaccination. So we need to also be mindful of protecting those that are still vulnerable. So if you have not been vaccinated, I encourage you to continue wearing a mask. If you and learn about what you need to do to protect yourselves and your family. The messages are the same that we've been sharing for a year and a half. It is still important to practice social distancing and hand washing and protect yourselves and your family. This has been a tremendous effort, and I would like to thank all the support we've received from the County Executive's Office, and we look forward to continuing to work with the Albany County residents to get us through this. Thanks.
Thank you, Dr. Whalen. And, I want to say to my workers, the workforce, to your families, thank you. I know it's taken a toll on your loved ones, it's taken a toll on your children, and the stress of working every day, if you're an essential worker coming in and then going home, it's been brutal. And I especially want to say to my wife and my children, I apologize. Unfortunately, they get the brunt of it when you're home and you're on the phone and you're stressed out. I owe you apologies to my daughter, who I announced she was pregnant and I'm going to be a grandfather in 39 days. I apologized to her when I announced she was pregnant and I wasn't supposed to, but the name of the baby is going to be Daniela, just to let you know. So I'm naming it, so it's going to be official, so I might as well get in trouble all the way. But to our HR director, Jen Clement, who really had to change a lot of our policy and procedures. Jen, thank you. It did feel like it was that episode of Everyone Loves Raymond when the in-laws were coming over and I kept trying to lock my door before you got in. But I do want to say thank you from the bottom of my heart for everything that you did moving forward. But Dan and George, thank you. But Dan Lynch, please.
So it's been a while since I've been on a daily briefing, and I was very happy to be asked to join for this kind of ceremonial in some sorts, but certainly with more work to be done. briefing. And, you know, it's been an exhausting 15 months. Definitely some more gray hairs, and I can't attribute those to my kids. And I'm not saying who they may be attributed to, but it's been quite an adventure. And I do want to also recognize some very important pieces to the county's COVID response team, and something early on in the pandemic that we established was an executive team, obviously consisting of our tremendous employees within the executive office, some of them new hires during the course of the pandemic who really stepped up, but also some of our commissioners, and a few of them are here today, and Commissioner David Latina from General Services, our County Attorney Eugenia Condon, and our Commissioner of Human Resources Jennifer Clement, to name a few. All played vital roles in our response, and for ever-changing landscape of rules and guidelines, they answered the call day in and day out and kept county government moving forward in a new way in which we were able to continue to deliver the much-needed services to our residents, and we cannot say thank you enough. For the executive staff who really answered the call, and I do appreciate at all times of the night or all days of the week picking up the phone for me or responding to emails. And a few of those employees are just, you know, such a vital piece in making the county executive and me in the deputy role able to move policies and initiatives forward that really help the residents of the county. And those creative ideas and innovative ideas and just the commitment of your time and energy to make sure that they happened is so very much appreciated. And I'll end without the county executive having any knowledge of what I'm going to say today, but I don't think that your efforts have been commended enough. It's easy to say as your number two, but
You just said I gave you gray hair.
well, that's true, and that's a fact. But I don't think that enough folks appreciate the grueling energy and effort that this took on you, your family, and all around you. And there were some tremendous things accomplished in a crisis, and you should be commended for your calm leadership. This briefing provided an opportunity for a clear and transparent recitation of facts and guidance as it was changing. And I've heard from a number of folks in our community how grateful they are to have you as their county executive in providing that outlet and information to them on a daily basis. And I want to personally congratulate you. There's much more to be done, but what has been accomplished thus far under your leadership certainly needs to be recognized. And thank you.
Thank you, Dan.
I also want to extend my greatest appreciation to Dr. Whalen as Commissioner of our Department of Health and her wonderful team. And she has mentioned a number of those individuals, and I've had the opportunity over the last year plus to work very closely with them.
Really, Carm?
And understand the value that they bring to all of our residents in the county. And Dr. Whalen's leadership through this health crisis has been nothing short of spectacular. So I really commend your efforts as well, Dr. Whalen, and you as well as the county executive have been steady voices of leadership, and we in the county are both very fortunate, we're all very fortunate to have you in leadership positions. So thank you.
Thank you, Dan.
Thank you, Dan. And, you know, it has been tough. And this reminds me, last time I was in Iraq, it was a 15-month mobilization. And it's not easy. And I was talking to some of my partners in the military that when you're away, you're dealing with your mission and the men and women around you. Now add in the element of your families and everything else and workers, it's challenging. It was a lot harder. You know, because you still have to be everything to everyone. This will be the last week for our mental health hotline, just to let everyone know, so we will be ending it this week. To Dr. G and his team, thank you so much. 518-269-6634, you can still call it. again, to United Way for the 211. Pete, I know that no one's really calling there anymore, but thank you to you and the team in United Way, not just what you do here in Albany County, but to the greater capital region. Thank you so much. To Karen Ziegler and her team, the 24-hour sexual hotline will stay open as always, like it does every day, 518-447-7716. I would love to sit here and tell you that it's going to go away, but unfortunately it's not. Again, I do want to say thank you to Dr. Whalen and her team, because it does take everyone working together. And I just want to remind people, healing doesn't mean that the damage never existed. It means the damage no longer controls our life. And we have to learn this from the COVID-19 moving forward. Damage was done. Can't let it control us. We got to continue to move forward. Before I take questions, if there is any questions and anything else, I do want to say some of the things that have fallen to the wayside is our honor vet, which we're going to get back on track next month and start honoring our veterans that laid their lives down for this country or just served our country. Citizen of the Month, which was fun to do and to, recognize an extraordinary person that wasn't a politician or wasn't a movie star, a rock star, athlete that just did extraordinary things in our community. So I thought, what better way to start getting back to some type of normalcy than to give Dr. Whalen and Mary Beth Miller and all the staff of the Department of Health and make you our Citizen of the Month, not just for June, but for the whole year. So thank you to you and your team. And to add more gray hair to Dan Lynch, I want to make you also the Citizen of the Month for June. So I do want to say to the two of you, to everyone, thank you. Everyone deserves it. Like you said, Dr. Whalen, everyone that stayed home and the stories we didn't hear because they did the right thing, thank you so much. Again, and I will say this, I had people say, you love having press conferences every day. I did not. There's a lot of work that goes behind it, and then you get tough questions at the end of the day, so I never know where the press is going to go. I never know the questions that are going to come at us, and it's not fun sometimes sitting here. So again, I do want to say to everyone, thank you for doing the right thing. This will be our last COVID-19 briefing, not unless something happens out of the ordinary or new guidance comes out that we have to get out, that we feel we should do it in person. But hopefully you don't see our smiling faces anymore. I know you're going to miss me, Daryl. You can come see me every day. I know some people are going to miss it. We'll still put stuff out on our social media sites and stuff like that. But it's time now to start transitioning into the new world that we are all being exposed to and moving forward. So thank you again to everyone.